License Director for the Burke County Sheriff's Office, and we are on another episode of Transparent Table Talk with the Burke County Sheriff's Office. This episode, we'll be talking about a very important thing that happened last week. The Burke County Sheriff's Office received over $1 million in grant money to fund not only youth violent crimes, but to fund other things that goes under the umbrella. So I'm here with the Sheriff of Burke County to kind of explain kind of what that grant does and how it's going to help us. So first, I want to ask you, Sheriff, how does it feel to receive $1.3 million in grant money for this agency?
Look, we're really excited about this $1.3 million that we've received from the governor's office. The governor recognizes that violent crime is on the rise in our county, in the region, in the state, and across the United States. And as a result of COVID, we had people that can't adequately cope with being in-house or being in close quarters, and we saw violence increase in our schools with bullying, and there's some issues with conflict resolution. We also saw gun violence increase, as well as suicides and other crimes involving guns, assaults, and such as that. And so this money is going to help us deal with those issues holistically. We've solicited the help of some of our social service organizations within the county, communities and schools, our public schools, our Department of Family and Children Services, Department of Juvenile Justice, and some other entities to help mitigate some of these issues. And we are addressing this issue from a poverty perspective. And Burke County is a very rural agricultural community. Poverty is very high. From an educational perspective, where parents may not have the requisite education to provide the necessary sustenance that they need for themselves and to include their children. So we're addressing it from that area as well, and it's a holistic approach to resolving violent crime. And so we teamed up with Dr. Mabry, who has worked across the state to address educational inequalities and to help families and get the required education that they need to make better choices, better decisions, which helps us reduce our violent crime.
Okay. And, with all that you said, can you just tell us about 2 or 3 things that's going to come out of, programs or incentives or things that are going to come out of that grant money that you are going to implement, coming up this year?
So we're going to have a program administrator who is going to work with our Department of Juvenile Justice, our juvenile intervention specialist who's on staff currently. We're going to use him to help administrate this program and provide the necessary sustenance that these families and specifically these children, these youth will need to deal with issues such as mental health, conflict resolution. We're going to provide programs and wraparound services to address many of the variables that our youth are faced with every day. We're going to teach them how to talk to one another, how to socialize. We're going to teach them soft skills. We're going to give them conflict resolution skills. We're addressing the mental health piece. A part of this grant is going to allow a mental health counselor to work alongside law enforcement and be the primary responder when we have children and families who are in crises. We're going to teach law enforcement how to recognize when an individual is in fact in crises and how to address that crisis from a mental health perspective, not from a law enforcement or a punitive perspective. And I think that's going to go a long way in addressing some of the issues that we have.
So kind of want to touch bases on what you just said about, because there's been a lot of cases where law enforcement have went to scenes and the person's not, doing anything wrong and doing anything illegal. They're just having a mental, a mental break or having a episode. So I want to kind of get your opinion and get your thoughts on, you're getting officers that training and getting officers to recognize those signs and just talk about how important that is, because just not only here in Georgia, but it's all over America. It's been cases like that, and people don't know how to approach mental health. And I want to know, just from a law enforcement.
Well, we realize that so often law enforcement is the only entity that's out there 24 hours a day, 7 days a week. And people call us when they're having a bad day. They call us when they're in crisis. They call us when they don't know who else to call on. And for so long, for decades, for hundreds of years, in fact, law enforcement has been used to deal with persons who or in diminished capacities or having mental health issues or crises. And we're there as a counselor and a psychiatrist and a first responder and so many jobs. But we are recognizing here lately, we've seen it across the country, where we're just asked to do too much. And we've tried to be too many things to too many people. And I think that progressive law enforcement executives, leaders have really started to understand that we need help. And we have been reluctant in the past to ask for that help. We're now recognizing, and there's monies put towards it, just as the governor has done in this situation. We're asking the mental health professionals to come in and to take the lead and to help us help people. And that's a big part of what we're doing here with this youth violence reduction initiative, is attacking the problem from a holistic perspective, recognizing that there are times when there are other professionals who are better equipped to address people in crisis. And I think that is going to bode well for law enforcement. Look, it's going to take us getting used to this, getting the proper training so that we recognize when we need to call in mental health professionals to help us navigate those very difficult waters that we tread through almost on a daily basis. And I was just here this past Saturday for 4 hours dealing with a family who had a crisis, who had a crisis all week, and it continued into Saturday, and we had an emergency situation. This would have been Saturday would have been a time when we really needed that mental health professional to step in. Last Sunday, I'm at home and I get a call about a person in a crisis, and it became a very volatile situation. This happens almost daily, and it's going to be huge for our rural community. We're very grateful to the governor for having recognized that we need this funding to address issues that really metastasized during COVID, and it's continued to be a problem. And we're going to be able to address it.
Okay. And also, could you just explain what the holistic approach is? Some people might not know what that means, or they might not understand it completely. So could you elaborate on that?
Taking a holistic approach, we recognize that as law enforcement professionals, we don't know it all. We don't have all the expertise. So we're calling in those mental health professionals to help us. We're calling in counselors. We're working with the Department of Juvenile Justice. We're working with the public school system. We've reached out to a grant expert to help us address systemic issues that have created the crisis that we find ourselves in. And so we are looking at Department of Family and Children Services, communities and schools, and other social programs that provide the proper sustenance that kids need to thrive and do better. We're looking at issues like travel and the inability to get to the programs and services that we offer. So we're trying to address transportation and just take a full view to find out why we're having violent crime and how do we go about addressing it. And if we get the parents better educated, then the children will be better educated and they will make better decisions together. It's bringing children to the table, but also bringing their parents to the table to find out what's going on in the home, what's happening, to decriminalize some of this behavior so that we really get to the root of what's happening. It takes all of us, and we're addressing this from a holistic perspective. We're calling in our partners and our stakeholders to help us find out what we need to do to make better decisions and make families better and improve people's quality of life. That's what's going on. That's what we mean by addressing this from a holistic perspective.
Yeah, I understand that because in any aspect, I always say, it starts at home. So people don't understand, like we can't wait till they're adults or till they're teenagers. It all starts, when at those small ages. So
It does, and we're addressing not only children but parents. We can't just bring children to the table. We've got to bring parents to the table. We've got to bring families to the table. We've got to give the parents the sustenance that they need to be better, so that they can in turn make their children better. We've got to address the educational piece. We've got to address the poverty piece. We've got to address the counseling piece. So often we want to send kids to counseling, but we don't have family counseling. So families have got to learn to deal with that child that might be in crisis, not just a child who's having compulsive behavior disorders, but the siblings have got to understand how to deal with that child when that child is in a crisis, so that we reduce violence from a domestic perspective. So there's so many pieces to this, and I think this grant is going to help us address those issues.
okay, and then a program that's within that grant is called the Cahoots program. Could you kind of just tell us what that stands for, and kind of elaborate on that? Or you do you?
So we're developing a rural model to the Cahoots program, and it's helping us to get some mental health professionals out in the field to respond when there are people in crisis. That social worker would go along with the police officer to a particular call, and they will serve in an on-call capacity. But that social worker, that counselor, will go out and recognize what is happening in that particular crisis and provide the services, the wraparound services that family or that child, that person in crisis might need, and address it from a social perspective and not particularly a criminal perspective as a law enforcement officer would do.
Just for context purposes, Cahoots stands for Crisis Assistance Helping Out on the Streets.
Yes.
So when you say
That's
on the streets, just kind of just talk about what it means to be on the streets.
Yeah, this is responding to calls for service with us. This is the emergency that I had on Saturday. I was here meeting with a family at 10 o'clock on Saturday, and a teenager called to say, my mom is in crisis right now as I'm on the phone with you. I had to get on the phone with 911 and get deputies to respond to the scene and to address the issue. And when they got there, the person was acting out and totally destroyed the kitchen and every dish in the kitchen, and it was a very volatile situation. That's where, and they had been to that address 5 times earlier in the week. That is a situation where when we got that call, we would have been on the phone immediately with a mental health person who can come out and be on the street with law enforcement and helping us mitigate that situation and giving her the best service that she could get. Jail was not where she needed to be. She was in a crisis. She had some mental health issues and needed a professional to help us deal with that. And so that's where that person would be responding on the street and be there with us to make those decisions.
Okay. And I kind of want to switch gears and go to the educational part of it, because not only is mental health and violent crime issue a thing, but we want to also address how education is. Our guest speaker for our podcast today, I'll let her introduce herself.
Hello, good morning, everyone. I'm Dr. Anise Mabry, and I am the founder and the director of the Dr. Anise Mabry Foundation. The Dr. Anise Mabry Foundation also operates the only community policing resource center in the entire nation that's dedicated to supporting our rural law enforcement agencies. And that's the Southwest Georgia Community Policing Resource Center. But it's available to any rural law enforcement agency that finds themselves in need of community policing support, community policing grant writing support. And when I say support, that doesn't mean that I write the grant for you, but that means that I teach you how to write the grant. Isn't that right, Sheriff?
I learned that, yes. But thank you for that.
Yes, Sheriff and I went, when he first sent me over his grant, he's like, I need a grant writer. And I'm like, no, you don't need a grant writer. You're going to learn how to do this yourself. And he did.
Okay. When you guys were working on this grant together and you collaborating, could you kind of just talk about your role and kind of what you incorporated within this grant along with the sheriff?
Yeah, so one of the challenges that leaders have, especially in our rural communities, is number one, they wear a lot of different hats. So when these grant proposals and these grant RFPs come down from the federal government and the state government, they are often 30, 40, 50 pages long. And when you are, again, wearing many hats, you get pulled in a lot of different directions. So, things that may be in the grant requirements that you may not always read or that you may not always catch or that you may not even know to put in there. And that's kind of where I come in at is I always tell the leaders, you start writing because nobody can tell your story about your community better than you. And that's why it drives me crazy when I see these rural counties go out and hire these grant writers who most of them don't even live in a rural county. They don't understand the challenges of a rural county and they're trying to tell a story of a rural county. So, I love for the people that I'm working with to tell their own story, and then I come in and I give them the support, and and I'll take the grant RFP and I go through and I show them how to read the RFP because a lot of times people don't know how to read a grant RFP to know what the grant funder is actually looking for.
Yes, Doctor, can you talk about? I know that you have done extensive research related to Burke County and where we stand on a reading level and a graduation level. You've also written a grant for the Burke County Public Schools, specifically the Burke County High School, to help in that regard. Can you talk about what your program does for those persons who may not have a GED or a high school diploma, and what you have done with your program? I know in Montezuma, Georgia, and some other counties, you've worked really hard. I was impressed with what you've done. I heard you speak in Atlanta, and that's how we got connected. Can you talk about that?
Yeah, absolutely. So Burke County is classified as a persistent poverty community, and that's under the USDA definitions of what a persistent poverty community looks like. Burke County, 32% of the 18 to 24-year-olds and 18% of the 25 to 34-year-olds don't have a high school diploma. So collectively, this is about 50% of your working age population does not have a high school diploma, meaning that even if the jobs are out there for people to apply and work, 50% of your population can't even apply because they don't have a high school diploma. Now, the graduation rate in Burke County is around 77, 78%, which is actually higher than the state average, but your graduation rate is only capturing your kids who are actually graduating in 4 years, meaning that when the kids drop out of school, that they're no longer counted in that rate, but the ones that are dropping out of the schools are the ones that are impacting the quality of life for everybody else in the community. And when you look at the when you do a side by side comparison with your arrests and your violent crime and the youth who are doing it, you, that population, that 50%, the 32% of the 18 to 24-year-olds and the 18% of the 25 to 34-year-olds, that's where the majority of your crime is coming from. It's that pocket of that population right there. And, one thing that I learned in working with Macon County, when I first went into Macon County, Georgia, the city of Oglethorpe had a crime rate of over 69%. There was one street in the city of Oglethorpe where officers couldn't even drive down the street without being attacked by the citizens. And when we went in there, the first thing that we started doing was I looked at number one, the adults without diplomas. And then I started looking at, so when you've got adults without diplomas, that means that you've got children receiving 50% or more of their primary care from an adult who doesn't have a diploma. That means that when that child comes home from school, there's no one there in the home to help that child do their schoolwork. So it becomes a generational illiteracy problem. And the first thing that we did was we started capturing the people who were actively on state probation and getting them high school diplomas. When we got them high school diplomas, we started noticing that, okay, as the adults are getting the diplomas, now let's put a program in place for the kids. So we rolled out the Macon County Chiefs Reading Program, and we started putting evidence based reading programs into the families for the children who were K through 8 to help improve reading fluency and math fluency. And then from there, we rolled into partnering with the technical college to get the adults who were graduating with their homeschool high school diplomas into the technical college so that they could get certifications and skills. In a 12-month period, just in us doing those three things, the crime rate in the city of Oglethorpe dropped from over 60% down to 16%.
Wow.
We didn't add any more officers. We didn't create hot zones. We didn't over police. We didn't arrest people. The only thing we did was we put diplomas in people's hands and gave them hope. Because when you have a community that has hope, that community shows up differently, and it's much easier to police a community full of hope than one that feels hopeless.
That's amazing just to hear those numbers and everything you did and turn that county around. Um, and here in Burke County, I want to talk about how the grant is, the educational part of it also to put people to work and how and how it's going to help parents get help that they need and help them to get into the workforce and on that level.
And that is a huge thing when you talk about your workforce participation. So a lot of people, they follow the unemployment rate, but few people are paying attention to your labor force participation rate. And the labor force participation rate is the most important number. And in Burke County, the labor force participation rate of that particular group that I gave you earlier is around 46%, and that's really high. So that means that 46% of the people who could be working, who there are jobs that they need them for, cannot get those jobs. When you think of your adults without diplomas, that's going to impact your labor force participation rate in your community. And a lot of people, again, get caught up in the unemployment rate, but that's not a true reflection of the people who are in the community who want to work but who can't participate in the labor pool to work. And in Burke County, that number is over 46%. And the large part of that is because you've got almost 50% of your population between the ages of 18 to 34 that don't have a high school diploma. And a high school diploma is one of the basic minimum entry requirements to a job. And it's not that people there don't have high school diplomas for the lack of trying or for a lack of services and support systems, but it simply boils down to the only program that most rural communities have to help people who don't have diplomas who are over the age of 18 is the GED program. And when you look at the GED program, you've got to factor in that only 20% of the people who take the GED test actually pass that test. So that means 80% of the people who are taking this test are failing it and they're not coming back to retest. So that's why the rural communities diploma program is so important, because we don't use the GED test. We actually use OCGA 22690. And if you're not in law enforcement, those numbers mean absolutely nothing to you. But OCGA is the official code of Georgia annotated, and that's where all of your laws are found. Most law enforcement officers are only concerned with, I think, Section 40, which is your traffic law. But Section 20 of OCGA is actually your education law, and Section 22690 is actually your homeschool law. And in Georgia, it is legal or a parent or a guardian to issue your own homeschool high school diploma to your child or a child in your care at any age. So that means that even if your child is 30 years old and doesn't have a high school diploma, as their parent, you can still issue a homeschool high school diploma, and it's still a valid legal document. It's still recognized by the military. It's still recognized by the police academy, by the firefighting academy, by employers, and by colleges. And so that's what we've been able to do. And that's how we're moving the number to get these people in these rural communities who are adults without diplomas. We're putting diplomas in their hands. We're getting them enrolled into the technical college. And again, we're giving them hope. And when a community has hope, they show up differently in law enforcement. When we think about adults without diplomas, when adults don't have diplomas, it's not a school district problem, y'all. It's not a law enforcement problem. It's a community problem because everything that they need impacts the quality of life of that community.
And also, I wanted you to kind of tie in, when we don't have a diploma and but not and people are not working, how that can tie into crime.
Absolutely. So when you look at the percentage of people who are incarcerated, who are adults without diplomas, over 60% of people serving time in jails and prisons do not have a high school diploma. And, when you tie that back to your youth, and when you look at 32% of your youth in Burke County between the ages of 18 to 24 don't have a high school diploma. You know, all of those factors play into it, and they can't get jobs. And I'm just going to be honest with you. People are going to live, and when they don't have a means to do it legally, they're going to do it illegally. So that's why having this rural communities diploma program in Burke County is so important, because we can't pass out enough food at a food pantry to save people. We can't, provide enough social services and intervention programs in there to save people. We've got to go to the root cause of why people are committing the crime in the first place, and that's how you transform the community. And the reason they're committing the crime in the first place is because they don't have a diploma, they can't go to work, they can't get a job, and they're doing nothing else. You've got to give them something else to do, because if you don't fill a void in a person's life without a diploma, they're going to find a way to fill the void.
Yeah, and so Doc, you helped me to write this grant. So just can you tie this all together and maybe 30 seconds on education, mental health, conflict resolution, bullying, lack of education, providing that education, just kind of wrap all of this up?
Absolutely. So this grant has four primary goals. Goal one is to reduce the number of juveniles who are committing violent crimes. That's our partnership with the school district and allowing the school district to refer students who are about to drop out or age out of school over to the Rural Communities Diploma Program. Goal number two is to provide mental health services on the streets using a modified Cahoots version. So, what that means is that deputies will have the opportunity to have real time mental health services on calls with them. We also have another grant that is going to embed mobile telehealth in both the jail and with the deputy on the call, so that when people are encountering the correctional services within Burke County, they're being met with mental health support both in the jail and on the street. Goal number three is to provide a juvenile counselor and true wraparound services. And that's going to integrate into all of this, because, again, when the pandemic hit, we weren't prepared and we did not navigate that very well as adults. And that, our inability to navigate well as adults spilled over into our children and our youth. So that's why we're seeing a lot more of the bullying, a lot more of the absenteeism, a lot more of the children who are not reading at or above grade level because their mental health has suffered. And number four, we're using all of this with literacy as the foundation. So we're rolling in some additional supports for our youth. And all of these things play together to reduce youth violent crime in Burke County.
And I couldn't have done that any better than that. I think that it speaks to what we've done here. We're really excited. We want to thank Governor Kemp and the Office of Planning and Budget for the state of Georgia for recognizing that our grant speaks to what is happening in the country and the state across the region, and specifically here in Burke County. This $1.3 million is going to go a long way in addressing some of these issues that we have. It crosses all socioeconomic lines and rich, poor, black, white, male, female. It's here. It's prevalent. It is impacting us from an economic perspective as well as just a quality of life perspective. And I think that these efforts are going to go a long way to mitigate some of those issues that we're seeing.